Hello and welcome to the next episode of Attention Deficit Hyper Desi. I am Ankita Jagtiani, Dadachanji. I'm an ADHD coach and I'm a fellow ADHDer. I'm based out of Mumbai and I'm putting together this podcast only on topics related to ADHD to get you information from experts here in India in a simple, relatable and absolutely stigma-free manner. So today we have with us Dr. Azhar Hakim. Thanks so much for being here,
Very
Doc.
happy to be here.
And today we're going to talk about ADHD and addiction in our episode. So Dr. Azhar is a certified therapist specializing in addiction. He's helped thousands, I don't know, maybe lakhs and lakhs of individuals and family to navigate challenges with addiction. So thank you so much. You also recently started the Mindset Wellness and Healing Center. So tell us a little bit about your journey, about mindset, everything.
Okay, so like you said, you're a fellow ADHDer. So I'm an addiction therapist. I'm a medical doctor. I did my MBBS. I got my master's in therapy. But I'm also a recovering addict and a recovering alcoholic, right? So, which is what drew me to this field, right? So I had this journey in which I went through med school, got through med school, decided I wanted to have nothing to do with medicine. It's not too cool for me. I wanted to do something cool and fun. Drove headlong into a 10-year massive affair with drugs and alcohol, in which my life was pretty much wrecked and my career was wrecked and my relationships were wrecked. And then I got clean. I got a lot of help getting clean. And once I got clean, I went abroad and got my master's. And then this is what I'm doing. So I've done private practice. I've worked with different organizations. I've taught courses in the US. And now we've set up this little outfit in Balpier called Mindset Wellness and Healing, in which we specialize not only on addictions, but also on other mental health issues. And we're trying to incorporate a wellness component into that also. But the overlap between ADHD, and which we were talking a little earlier, and addiction is just staggering, right? You must have come across that itself. So the research tells us very, very clearly, right? I'm quite a science nerd. I follow a lot of research. That over a half of people, actually 30 to 40% of people who present with an addiction will also have ADHD. Right? And the prevalence rate of addiction disorders in people who present with or who have ADHD is almost double the national, right? So it's bi-directional.
Interesting. Do you feel a lot of them get diagnosed with ADHD before, or it's the addiction that comes to play and so they get diagnosed?
So that's the nature of the practice, right? So you're primarily an ADHD coach, right? So the people who come to you will be the people who are already aware or are struggling with the ADHD.
Sure.
And in the course of your work with them, you'll say, that weed habit of yours you might want to look at, right?
Right.
In my case, it'll be ulta. Right? A lot of them will present because I'm the addiction therapist, will come to me. The large numbers of them have got undiagnosed ADHD. They don't know they ever had it. They've never got it to their attention, leave alone getting treatment for it. And then they come into recovery and they start getting clean. And then, so you get the substance out of the way, it unmasks the ADHD. Right? Because a lot of the substances were helping regulate some of the ADHD stuff. Right, so now you're 1 month sober and their brains are bouncing all over the place, or you're just in la la land, the inattentive type, right? And that's when we do a little bit of testing, and a large proportion of them will meet criteria for ADHD. Like I would say 30 or 40% of my practice.
Really? Wow.
Yeah, and the problem has been, see, in the past, the mainstay until very recently, globally, but particularly in India, for ADHD has been medication.
Sure.
Right? And the medication is stuff that I would get high off.
Fair enough. Yeah.
Right? So it's a very difficult decision to put somebody in early recovery and give them a strip of medication to self-administer.
Right.
Right? So when this whole world of ADHD coaching came on board, right, that is a game changer. Right?
Interesting, because that's where you learn skills rather than depending
On the
on the medication.
Yeah. Because a lot of people in addiction recovery say, look, doc, I don't want another pill, man. There's so much substances I put into this thing. Now, it depends, right? You're mild, moderate, severe. Some people are severely ADHD. Then the medications are going to be necessary, at least for a short period of time, right? But a lot of them may not need it. And so if we go with client choice and client self-determination, if they prefer not to do it with medications, then it's our way to try to figure out, okay, let's give it a shot, and if that fails, medication's always there, right? So to have this world of ADHD coaches now, which wasn't there when I started practice, right, is phenomenal.
I have so many questions. Obviously, my mind is going to 1, 2, and 3. But the first thing I'll ask you before we go deeper into our conversation, you mentioned you're still a recovering addict, right?
Yeah.
So why do you say that? Why do you still say recovering?
So recovered would mean that I can have 2 drinks and stop. If I have 2 drinks, within a month I'll be back in rehab.
Really?
Yeah. So there's a biological basis to all of this, right?
Okay.
So what we don't understand is that addiction is a medical disorder. It's not a character flaw. It's not a moral weakness. It's not that, right? So if you take a condition, let's say like diabetes, I'm just going to digress for a bit, right? There's a whole bunch of universe of people who eat unhealthy food.
Yeah.
Right? It's part of our Desi culture.
Of course.
Right? Only a fraction of those will develop diabetes. Only around 20% will develop diabetes.
Yeah.
I mean, you may have obesity, you may have other issues, but diabetes only 20%.
Sure.
Right? So it's not the unhealthy food per se that creates diabetes.
Very interesting.
You need a metabolic biological response. And you put those together, you get diabetes. What happens in diabetes? You get impaired glucose tolerance, right? And they'll say you get hypersensitive to carbs. Yani ki you and me can eat the same meal, same quantity. Your sugar will go to 140. 2 hours, it'll come down to normal. I'll eat the same meal, same quantity. My sugar is hitting 240, taking 5 hours to come down. So I'm diabetic. There's no cure for that. There's no point in my life in which I can say I can eat this amount of carbs and my blood sugar will not spike, right? So, and most medical conditions are chronic conditions, right? Arthritis, diabetes, hypertension, they can be managed. You can live a fantastic normal life if you take a few precautions, right? The same applies with addiction, right? There's a vast amount of people who use substances in our lovely city, right? Copious amounts of it, right? Only 15 to 20% will develop an addiction. They may have other issues. You may get into aggressive behavior. You may act like an idiot. You may get into embarrassing situations. But that's not addiction. That is stupidity, and that is intoxication. Right? Addiction happens again because of an abnormal metabolic response. What people with the addiction have is an abnormal response to abnormal release of dopamine.
Okay.
So, which means what? If I tell you I love coffee, coffee is giving me 100 units of dopamine. Right? If you say you don't like coffee, which then I think you need therapy. But if you
we have 3 people here.
Non-coffee drinkers, no minor vices. So if you don't enjoy coffee and your brain is only giving you 20 units, you'll say it's not my scene. Sure. If I tell you more than coffee, I love food at a particular restaurant, that means it's 200 units. So most of these mind-altering substances will act on different parts of the brain, but there's a common system, the limbic system, which releases the amount of dopamine.
Sure.
So most people who enjoy substances will get 200, 300 units. And these are not exact numbers, this is just for a scale, right?
Okay.
The potential addict or alcoholic like me is not getting 300 or 400 units. I'm getting something like 4,000 or 5,000 units.
Wow, so that's the, like 10x.
10x kind of a thing, right? So let's say first time in life we go drinking. We're 18 years old. He picks up his glass of whiskey. He's getting only 20 units of dopamine. He's saying, what is the bloody big deal here? Everybody talks about alcohol. But chalo, everybody's drinking. I'll also drink a little bit. You're the normal drinker. You're getting 300 units of dopamine. You think this is good, man. I should do this once in a while with my friends. I'm the budding addict and alcoholic. I'm getting 5,000 units of dopamine, right? So you all have no frame of reference to understand how that's making me feel. So what do? I will seek it out more frequently.
Sure.
And in larger quantities.
Fair enough.
You'll have one group of friends which you hang out at the weekends. I'll make 5 groups of friends who like drinking, right? And for the first 7, 8, 10 years, now it depends on the substance. Like if you're doing heroin, you'll crash and burn earlier. If you're doing alcohol and marijuana, it takes a little longer for the consequences. But what's happening in this period of time, right? my brain is not designed for this level of dopamine. So what it does is, in order to reduce that euphoria, it reduces the number of dopamine receptors.
Okay.
So receptors mean the dopamine has to act on the receptor, and then you get that euphoria blast. So it says too much blast ho raha hai, let's reduce the receptors. Right? So what do? I drink more. And then it'll reduce the receptors further. And then I'll drink more or use more or whatever my substance is. Right? Now, what's happening is, so now I'm no longer drinking for high, I'm drinking for a relief. I'm feeling terrible because those receptors that we're talking about are not only responsible for alcohol-induced pleasure, it is responsible for all types of pleasure in life. So now when I'm not drinking or using, I'm miserable. I don't enjoy the same things that I want to do. I've lost interest in a lot of activities, and the only thing that makes me feel somewhat good now is my substance. So that cycle continues. Right? So there are the biological changes in the brain. There are gazillion studies that have been done to say there are neurological and biological changes in the brain. The good news is that if you stay off the substances, somewhere between 1 and 3 months, the brain realizes this dopamine blast is not coming. So it upregulates the receptors. And then you experience a freshness and a vitality that you've forgotten because of all the years of use. And then you start enjoying other stuff. Right? And then you come to the next problem. Then you get complacent and say, now I can use a little bit.
So that's why recovering is, you're always recovering.
Yeah, you're always recovering. So in the sense, you're managing your condition, right? Sure. So as long as, like with diabetes, they'll give you 5 rules.
Yeah.
Eat this, stop eating this, do exercise, dawaii le lo. With addiction recovery, there are a few simple rules. If you follow those rules, you'll be fine. If you mess around with the rules, there'll be hell to pay, but not because you're a bad man and God is punishing you. Like, if you're a diabetic and you're abusing carbohydrates, you'll end up in hospital, not because you're an evil person and God is punishing you. You got a medical condition, boss. If you don't take care of any medical condition, there will be consequences. And if you don't treat any medical condition over a period of time, it'll get worse, no?
Yeah.
So no diabetes is going to say, okay, for a while I won't eat carbs and suddenly I'll be able to tolerate carbs. Nahi hone wala hai.
So what are those few rules? You said that there are few rules that you...
So there are 3 things that are essential for addiction recovery, right? One is you require motivation. You got to want it, right? The second piece is you require a strategy. This is not about just willpower, right? Which is what we call the relapse prevention plan.
Sure.
And the third thing is you need a community. You need support. Right? When you put these 3 things together, right? So the motivation you have to bring to the table, right? We can encourage you around the way and we can sort of work with you to keep your motivation at the level, because whatever setbacks and frustrations you have, we can help you manage that. The strategy is a lot to do with triggers, right? And so there are 2 classes of triggers. There are external triggers, which are people, places, and situations. And there are internal triggers, which are feelings. So for some people it's anger, for some people it's boredom, for some people it's loneliness. And that's why the recovery plan is highly individualized, because your triggers and my triggers, right? And so we then help people identify your triggers, right? And figure out healthier ways to cope with them. And what do you do when the trigger comes, right? So that's a combination of self-talk, and that's a combination of behavioral strategies and a combination of social support. So if you have a bunch of people who are doing this with you, who've got time in recovery, then you have a hotline that you can call, no?
I don't know. Hey, I'm feeling this way. And they actually get you.
They get you because they've been there, right? So they've been there. So you put this together and it's very highly individualized, because some people will say, I don't struggle with anger, but boredom, I need something to do all the time. Which then flags me about ADHD, right? Which is when then I start thinking, okay, is there something here? So we do a lot of the testing for the co-occurring ADHD and other mental health disorders generally after you've got a month clean, because the first month you're bouncing off the walls through the withdrawal, the agitation, and all of that is still there, right? At the end of that, if you do a test, you'll find a high proportion of people will have ADHD and other anxiety, depression disorders.
So rehab becomes a very important part, or can somebody also say, I don't want to go to rehab, but I will sort of cope with it in my environment?
So yes, so rehab, so again, it's about any condition is mild, moderate, severe, right? So when does rehab, so rehab is like surgery, right? You don't consider surgery as the first option.
Fair enough.
Unless there is a compelling reason.
Sure.
So rehab is if a person is unable to stay away even for a day or 2 days. He's just unable to, the cravings are so hard, the addiction is so deep, right? That he's unable to create any distance between him and the substance, in which case no amount of therapy is going to be effective.
Understood.
Right? So then you need to be in an environment in which you don't have access, but the key part of the rehab is what is the type of programming there. It's not just about locking you up. So there's a certain amount of programming that goes on with rehab, right? If you're in the moderate stage, if you have had periods in which you can stay away for a period of time, then there's an outpatient program that you can run. The duration is pretty much the same. A lot of the programming that would happen at the rehab, you do that outpatient. So you don't have to leave family. You may have business interests because it makes it difficult for you to go out and all. So then you can do that outpatient. But that's the assessment we do.
Okay.
Right? Because there are some people who will need to go to a rehab and there are some people who won't need to.
And what's the duration generally if somebody goes to rehab? Now I know it can completely vary, but what's generally?
So a minimum of 30 days.
Okay.
A minimum of 30 days. Generally, you end up being there for a couple of months. Most outpatient programs also are at least 2 or 3 months. The one we have is 3 months. So thank God, when I was growing up, this idea of mental health and getting counseling was unheard of. Now at least there's an openness and awareness that I require counseling and I require therapy, right? But there are 2 or 3 conditions in which you require a program of recovery rather than just individual counseling sessions.
Sure.
Right? So that's when you have trauma, particularly sexual trauma, when you have addictions or you got eating disorders. Just once a week meet to your therapist does not hack it.
Sure.
You read a much more intensive bouquet of stuff, right? Which is generally a combination of individual counseling, maybe a couple of times a week, group therapies, family counseling. So we have a support group for family members. Right? Because by the time people come into recovery, the families are like completely shattered.
Sure.
Right? And so the families can then tend to get overprotective, get very, very policing kind of thing, which comes from the right place, but doesn't land well, right? So we give a lot of coaching to the families about, okay, how do you manage the situation? If you suspect the person has had a drink or what, how do you approach that? How can we help with that whole process? So the family component becomes important. The group therapy is a critical piece of it, and the individual. And then some people will require meds. So you require a psychiatric consultant and, all of that. So you require a program of recovery for addiction. Quite often with anxiety, depression, other conditions, once or twice a week counseling sessions, you're fine.
Understood. If you have that support system in place. Because like you mentioned earlier, also medication also, I'm guessing the family will have to support the individual with rather than...
And most people, first family members, if the client is ready, family say, I don't want my kid on meds. Baba, I'm not dispensing meds because I'm getting a cut from some pharma company, right? And my default position is, if it's possible to do this without meds, let's go down that route.
Sure.
But every now and then, depending on the condition, because the common thing is insomnia, right? Because you're used to your substances putting you to sleep. Now you take this, you're wide awake at 3 o'clock in the morning, then you're exhausted, you're irritable, much more likely to get triggered.
And ADHD and sleep anyway have a tough relationship. So this sort of adds to it. So when we talk about substances or addiction, we only, I think first few things that come up are alcohol, drugs.
Yeah.
Right? What are the other types of addictions?
Behavioral addictions, right? So there are substance addictions. The most commonest in India is alcohol, followed by cannabis, right? And then you have cocaine and a whole bunch of others, right?
Sure.
Other than that, we have what we call process of behavioral addictions, in which there's no substance involved, but the person is getting the same dopamine blast by an activity, right? The most common in those are gambling, gaming. So ADHD and addiction, gaming is at the heart of it because they can spend 8-9 hours gaming, right? That hyperfocus kicks in.
Right.
So what happens in ADHD, right? ADHD, the whole executive functioning, it's a problem of executive functioning, right? There are low levels of dopamine, right? So which lead to executive planning, and that reward that you would normally get is missing. So the idea that you have to consistently do something without a reward. Now this person's brain is wired that way, right? Right? We know that there are lower levels of dopamine. Right, in that. So the dopamine is a chemical that gives me a reward. So for me to sustain any task, if I'm getting some kind of reward in it, I'm able to do it. Because there are historically lower levels of dopamine in that, the impulsivity is very high to seek anything that's going to give you a dopamine blast.
Sure.
Right? One of which is a substance, or could be a game. You could get into online gambling. Once you find what is giving you that dopamine blast, because you don't generally experience it, your hyperfocus kicks in. Right? You can do it for hours. So a lot of people will come and tell me, he's lazy, man. He doesn't want to sit for 1.5 hours with his studies, but he can do 8 hours a game. So what is his distractibility? Where is the inability to focus? Now, how I break it down to them, right? If you come at it from the point of interest rather than concentration, right? So most of us, if we don't have interest in something, but if it's boring, but if it's important, we can bring ourselves to do it.
Okay.
What I've realized is when you have ADHD, however important it is, if it doesn't focus my attention on it, it's like pulling teeth. I can't do it.
In Indian households or Desi households, we often hear, like you mentioned multiple times, lazy. You're not keeping good company. So you have bad company, your friends are not good. What are some other misconceptions that you hear of very commonly?
These are the two biggest ones, right? So the common thing is you're lazy. You're not responsible, right? You are very privileged. That's a big one now.
That's a new one, right?
Yeah, very privileged, right? Very entitled,
right?
Just because we are not saying anything, this thing, right? You've gotten into the wrong company, right? All of that. He may have gotten into the wrong company because he's unable to do this stuff academically, so he gets some comfort with people who are also like not doing so well. Because if you're not doing so well in class and you're hanging out with these guys who are getting A plus, how are you going to feel about yourself? Pretty crappy, right?
Yeah.
So then you gravitate to a group which is not that high pressure group, and then your parents will think it's because you've got there that your academics is up. But it's ulta. I've gravitated to this group because they accept me. They don't give me pressure and gyan all the time about this, that, and the other.
So there was an amazing study done on this, that somebody with ADHD before the age of 10 is already reprimanded over 10,000 times.
Yeah.
So you're subconsciously thinking that you're not good enough.
Yeah.
Right? So I always say that procrastination is an effect. It's not a cause.
It's not a cause. Absolutely.
Similarly, addiction is an effect of something. It's not a cause. One of the causes I understand from you is, just the way your brain is wired.
Yeah.
What are some other causes that tend to lead to addiction?
So a lot of them are contributing factors, right? So you will see kids who grew up with ADHD and even trauma. Okay. So let's look at trauma, right? Let's look at a childhood that's been difficult.
Sure.
And because of that, you've developed lower self-esteem. You maybe have a little bit of depression going on. You've got a little bit of anxiety going on. And then you stumble upon cannabis or you stumble upon alcohol, and for a while it makes everything better. Technically, unless they're getting the dopamine blast, you will not become addicted. You may misuse it, you may abuse it, but that is different from getting addicted to it. Addictive is when you have a certain process going on. On the outside, though, from clinical practice, it looks identical. Now, because 1 in 5 people or 1 in 6 people will develop addiction, the more people that are relying on substances to self-regulate, the higher number of people will get hooked onto it. So environmental factors, so whether you're dealing with it, so again, the same thing holds, right? There's a whole bunch of people who have mental health issues, who will abuse substances. Again, not all of them will develop an addiction. They may develop other issues because of it, right? You may get in trouble with the law, you may get thrown out of college, you may get all of that, right? And it still needs to be addressed, right? But it's a little different animal. ADHD also, right? A lot of people with self-medication. Cannabis works wonders, right, in just settling your brain down, right? And the thing I tell a lot of people, right, if you are using substances in your teenage or late teen years to regulate emotions, to find hacks in life, the chances of developing an addiction are very high. If you're doing that once in 2 weeks, drinking like an idiot and falling flat on your face, you may get into awkward, embarrassing situations. You're not going to develop an addiction. When we use it to cope with feelings or to help our brain focus, then you're becoming reliant on that substance over a period of time, and you'll come to a point that you won't be able to do the basic functions without the substance.
So you mentioned in one of your other podcasts that you had that family support personally, right? You were studying to be a doctor. But despite that support, there was a lot of pressure. What are some of those pressures, if you don't mind answering?
Yeah, so I grew up in this hyper-achieving family, right? The conversation around the dinner table will look at your grandfather, he's done this, look at your father, he's done this, look at this cha-cha, look at this thing. I am the firstborn son and I'm the firstborn grandson, right? And I hear all these stories about this person has done this, and I said, Meri to band baji, right? So instead of feeling inspired by that, I felt terrified that I'm going to disappoint these people, right? And I started believing that the love and acceptance I would get in the family would be contingent on me performing and achieving. Wasn't true, That's wasn't where they were coming from, but that was my perceived reality. So I always thought, okay, I'm not as smart or as good as my family think I am, but they should never find out. I must do well. So I did very well in school, extracurricular sports, because I enjoyed it. Not really. It was just that was what would get me acceptance. So I had this sense of inadequacy and not being good enough for a long period of time. My brother grew up in the same house. He didn't have that. Not that he talks about it, I don't know. My brother can use substances and he drinks. He didn't develop an addiction. I did. So while these factors are important contributing factors, unless the metabolic piece is there.
Sure.
But what's that message to parents? You can't take that chance because we don't have a test right now to figure out who's prone to addiction and who's not. Okay. Right? So all these pressures that you're putting onto your kids in terms of expectation. Today, kids in Bombay is tougher than a corporate job, man. It's 7 o'clock in the morning, you're going for football, then you got a whole day in bloody school, then you got 2 tuitions, then you're all these extracurricular stuff, and your weekends are crammed, and it's all achievement, performance.
Right.
Extraordinary levels of stress that kids are dealing with, right?
Yeah.
And then you want your kid to go to a good school, good, that's the other big thing, na? Okay, top college mein jana hai for your bachelor's.
Yeah.
So there's so much stress and there's so much pressure. The other thing is, when I was in school, my peer group comparison was the 25 people in my class. Now your peer group comparison is social media.
Sure.
Right? So you got a gazillion ways to feel not good about yourself. And then to find a quick fix that will make you feel better. Now that may end up being online gambling, that may be gaming, that may be substances, right? Something to take the edge off. The chances of that evolving into an addiction are pretty high.
So you feel that over the next decade or two, there will be more and more people. You feel the numbers of addiction will go up.
Yeah.
It may be substance, it may be behavioral.
Yeah, it may be. And access, right? If you have, so the more easily stuff is available, which is going to hijack your dopamine system, the more likely you're to do. So if I was growing up here at the time with these cell phones, right, I would have no chance. I would be glued onto that thing all the time because the dopamine blast is just incredible, right? You're doom scrolling, you're getting all the, and the algorithm feeds you stuff that is going to grab your interest, right?
Sure.
So it's a very difficult thing for kids, and young adults, not only kids.
And a new thing that I've been hearing is, I'm not addicted, but it helps me function even better.
Yeah.
So
no, you are. So you could be addicted. So cigarette smokers, right? So this is a very good point. Most people who have an addiction, right, at some phase are functional. The addiction is helping them, right? So cigarette smokers.
Are they saying that, or do you really feel that it helps them?
No, they're saying that, but
it actually is.
I come back at home and I have 3 drinks and it helps me relax. It helps my brain turn off.
And that was actually the norm, right? I come from an army family, and my granddad, every night there were minimum 2 drinks everyone would have and go off to sleep.
Yeah, but the alcoholic will want more. The 2 drinks. So, okay, that's a very good point you bring up, right? So you will go through a phase in which you'll be what we call your functional addict. You'll be doing your school, so you'll get up in the morning and you'll wake and bake. You'll smoke a joint. That'll take the edge off. You'll go through the day. You'll maybe spark one more in the afternoon, right? And then you'll spark one in the night, and then onto this thing and all, right? So it's like, think of cigarette smokers, right? You need a cigarette every 2 hours. It's not affecting your performance. In fact, it's helping you de-stress. Sure. That doesn't mean you're not dependent on it. You can be addicted and functional up to a point, but addiction, like any other condition, over a period of time, if untreated, will get worse. Right? So you're going to need to up your dose to get the same effect. Right? So if you're thinking that this is going to stay where it is now, A, the chances of that are unlikely. B, the other thing that will happen is that you will realize that without it now you can't function. So you're squarely on that, right? So the elevator is going down. You got to decide if you want to get off it. Right? And that's the other thing I tell people, I can't make that choice for you. If you want to get off it, I can help. Right? I can give you the pros and the cons of it. I mean, with kids it's different. right? But with the adult, you got to give them the pros and the cons, and you got to sort of present this to them, and you present the facts to them. And most people, if you actually speak to them in a non-judgmental, not I'm going to scare the bejesus out of you, or I'm going to stigmatize you, or demean you, or put the fear of God into you. I'll just present the facts to you, boss. Okay, this is what is going to happen, right? And the other thing that I get, right, is my cousin does it. I'm fine now. I'm controlling it. So what do you mean by controlling it? Yes, I'm drinking only 4 drinks. In the past, it was a lot more. I'm drinking only 4 drinks. And what I explain to them is the very fact that you have to exercise control is probably diagnostic of the problem, right? So if me and my cousins are sitting at home and drinking, like you said, in your family, everybody's drinking 2 drinks. After that 2 drink is over, they're not fighting the desire for the third. There is no application of willpower. It is a non-issue. If I am the alcoholic, I can make myself stop, but I'm not satiated. I want that one more. I want that third and fourth drink. And so today I'll use willpower. Azhar, you said only 2 drinks, not anymore. Okay, damn good, well done. Tomorrow I'll do it. Statistically speaking, third day you'll come home for dinner. Ankita is here, yeah. One more drink. I had a very stressful day at work, yeah. One more drink. My friend is getting married, right? My body is demanding the alcohol. My brain is making up the reasons. Right? So the very fact that you have to exercise control means, so who's a person who contemplates, should I give up or not? Only if the substance of whatever behavior is creating a problem in your life. Now, why would you think that I need to give up or quit? Something is happening and then you're making an effort. Right? So that itself tells you a lot, okay, that and people don't like to hear that. I'm controlling it. Boss, how long you want to control it, man? Your brain is, if you're an intelligent person, your brain will give you 30,000 reasons.
Sure. So we look at addiction as, at least in India, I don't know, you can share the other context also, as not just an individual challenge or a disease, as sometimes that word is used sadly, but it's also looked at as a family challenge, right? Do you think that has changed over the years? Are families more accepting? Are they more empathetic? Tell us about that.
So it's moving in the right way. We're nowhere near where we need to be.
Sure.
But it's definitely better than what it was 10 years ago, both internationally and in India. I can speak about urban India, right? Because that's what I know. Right? There is a greater deal of acceptance. There are a lot of questions that families will ask in order to figure out how we can help and how we can support, right? And they're much more open than they used to be, right? And you got to understand, so if you say something is a disorder or a disease, right? Diabetes is a disorder. Diabetes is a disease. Now, the family can help, right? In certain ways. If you're going to be making kilos of biryani every day while your loved one is trying to keep off it, maybe for the first month or so, you should, right?
Right.
How would you encourage him to stick to his diet?
Yeah.
Right? So the family plays a big role in either making the condition worse by shaming the person or being supportive. And the trick with the families now, which is why we have the family support group, is how to learn to be supportive rather than directive. Right? So the solution is not that my wife takes control of my diet.
Okay.
Right? I make the diet plan, right? And my wife figures out how she can support me in this, right? Because if I outsource the diet to my wife, then my job becomes to cheat. Her job becomes chore police game, no? Right? So the family has to be brought on board, right? And yes, it is a biopsychosocial problem. Addiction, right? There's a biological component, there's a psychological component, and there's a sociological, social component to it. The recovery plan has to deal with all of that, right? So the psychological stuff is the emotional stuff that happens. There's the biological stuff that I spoke to you about. The psychological is the emotions. There's a whole bunch of emotions. People will deal with a lot of resentments. There will be a lot of fears and insecurities. There'll be a truckload of guilt and shame. Right? There'll be issues with self-confidence. There'll be issues of all of that, right? All of that is part and parcel of the condition, right? And then there's the social, your family relationships, your relationship at work, your ability, how am I going to have fun in life, right? All my friends are now still doing cocaine, Right now, how am I going to hang out with them? So that whole social, so the recovery plan has to incorporate all these elements, right? And all of these factors are critically important in which to navigate. It's the first 3-6 months. It's like you're walking a little bit of a minefield.
So, like you said at the start, motivation, strategy, and
support.
community.
Yeah, community.
And that community includes family,
friends, family, maybe somebody
way.
from your work, maybe a chacha you haven't kept in touch with a while. Who gets it? Who's going to be there for you? Who's the 3 a.m. call?
Sure.
Who's going to get me?
Yeah.
Becomes very important.
Many a times people use substance, or specifically substance, because addictive behaviors you see at home also, right? Whether it's, if you're gaming, for example, gambling again, I would look at as something that you will be hiding and doing.
Yeah.
Right? So that is if you're hiding, I'm guessing that's an early sign.
Yeah.
That
very, If you're doing it on the sly, absolutely.
What are some other early signs? I understand hiding, and I understand that you need it, that need. Apart from that, what should people see?
So early on, you find yourself thinking about that activity and planning how I'm going to indulge in that activity. It starts becoming the centerpiece of planning my week. Okay, Monday evening I'm going to come out and play 3 hours of games, or I'm going to, there's a lot of time allocation that's going into this. That's the first thing. So I'm getting more preoccupied by it. I'm spending more and more hours in this activity or this substance. If it's a substance, or even if it's gaming, it's having consequences on the next day. Right? That I get up late, I miss class, I miss work, I don't want to do all of that. People who are loved ones around me, my friends, cousins are pointing out, boss, I think this is getting that is generally because they can see. Right? So those are things. If I'm doing it on the sly, if I don't want anyone to find out, definitely that's a red flag. Right? If I get very annoyed and irritated if people point it out to me.
Okay.
Right? So all of these are very early signs that something is going off.
How should somebody address it? Like, let's say I see, or a friend of mine sees me using, or feeling the need to use a substance, or sees an addictive behavior. Generally, if you, like you said, if somebody points it out and they feel triggered, in this case, I feel triggered, what would be the right approach for that person to point it out in a way that somebody should not feel triggered and actually get help?
Right. So if you want to point it out to a friend that you're listening, right? So you got to say, okay, so where am I coming from? I'm coming from love and concern. I'm not coming from shame or blame. So my communication has to reflect that.
Okay.
Right? So I will always use the preface, right? Because if somebody is developing an addiction or going down their path, that doesn't define them, right? They still may be they still have 5 or 6 things that they're great at. Right? So I would always preface it by saying, look, I just want to talk to you about this, right? You're doing a fabulous job with this, you're doing great with this. I would give a little bit of validation to recognize that. And then I would say, okay, but look, the drinking, right? I know, I would always preface, look, I know this is a sensitive topic. Probably none of my business, but I've seen you, man. I've known you for so many years, right? And this is like I noticed, and always give concrete that I noticed last Friday.
Okay.
I noticed this thing again. Not shaming you, not judging, just saying that this is flagging in my head, right? You may want to look at it, right? I'm here to talk anytime you want, okay? So first get them, instead of saying you need to see a therapist, right? You're trying to get them to acknowledge, okay, even if they don't want to say this is a problem, but this is something I want to look at. That's the first step, right? Because otherwise, the irritation and the denial will just bury it, right? So if I feel somebody's talking at me, I don't want to listen. Then I'll point out some shit in you, no? You're talking about my drinking. Look at this. Look at the way you speak to your mother. Look at that. They're pointless. So the person should feel this is genuine. This is not a judgment. This is not a this thing, right? And say, I'm just concerned, man. Right? So you get the person to look at it, and then you check in. That follow, because I think I've said it once now, my job is done. Right? You also can't check in every day. Right? Because then that person is not going to take your call. Right? So it's about holding that space, and then to figure out if they're responding well and good, right? Some of them, if you just bring it to their attention, are able to dial it back. before it's developed into an addiction. So what you want, right, is you want that person to be then telling you, look, man, I decided I wasn't going to go and game, and then this happened. If he or she is opening up about, I'm trying but it's not working, that's when you generally introduce, maybe you want to talk to a counselor.
Sure. In India, this is still a bit of a we like like when I was in school, if a friend seems like they're in a bad state, or actually let me give you another example. In college, one of our friends was dealing with something, and so there was a lot of anger coming out in different ways, aggression. And now the first thought that the friend group had was, should we call his parents and talk to them? Right? Because I think in India also, you know your friends, you know their families, etc. Is that something that should be done?
So sometimes yes, right? The question in your head is, who amongst our friends group or his family is likely to be able to get through to him?
Okay.
Right? So there's some stuff I will hear only from my wife and my loved ones, right? You give permission to only a few people to call you out on your stuff, right? So the thing is, okay, so who's the best person to address it, right? Sometimes there is somebody in the family. Sometimes it may be his brother, sometimes it may be his parents, right? Sometimes there may be somebody in the friends group, right? But to just call the parents and say, look, we've noticed this and all, without thinking it through about what the dynamic with the parents and the kid is, can sometimes be counterproductive, right? And it's also sometimes the word, not my problem, they should deal with it.
Right. So earlier when you were talking about when the early signs, one thing that really was coming up was that with ADHD, people just focus on one thing. So this becomes sort of the hyper focus in the day. And like you said, then they plan their entire week around it. So that's something that should be addressed early on.
Sorry, another thing also is mood changes. If you notice irritability a lot, if you notice this person's getting more and more isolated, those are early warning signs. And that for the person also to realize, okay, I'm getting more aggressive, or I just don't want to hang with my friends, I'd rather sit home and play games. Those are also early warning signs. So that's the behavioral stuff.
I remember, so my uncle is a recovering addict now, I will say.
But by the way, that's down to the person to say what they're listening, right? Some people don't want to say I'm a recovering addict.
No, but I think it makes so much sense, right? When you explained it, that you're sort of always in the process of recovering.
I'm a diabetic, right? I mean, it doesn't define me.
Yeah,
but it's a part of me. There's no shame around it. It's the same with me being an addict. There's no shame around it. But better I don't forget that I'm a diabetic, no?
Yeah. So one of the stories I heard early on, when I was probably a young kid, was that how he needed some money to buy substance, and he went to, of course, the family knew what was happening. Doctors had recommended not to give him any money because he would use it to buy drugs, etc. So he went with his bike outside some random family friend or somebody, the family knew their house, and rang the bell and said, I'm so sorry, I have to ask you for some money because I'm out of fuel and I'm stranded. Now, also earlier on, even now, I think nobody tells everybody, oh, my kid is an addict or is having these challenges. It's contained. What are some of the stories that you have heard? Because I feel like lying comes very easily.
Yeah, it's part and parcel of it, right? So, I mean, so this is the norm. That I need to figure out a way to get high. For that, I need money, right? And then in the middle of that obsession and that craving, there is no moral compass that can stand in front of that. You will lie, you will do whatever, right? How does the family manage this, right? What I've noticed is, right, that you can put certain amounts of checks and balances that we're not going to give you money and all, right? The options that they have of asking people run out very quickly. Right? The family overreacts at the first one because then this house calls up and says he came and asked for money, and then we have an overreaction. Right? What we have to understand is that he is going to run out of these options at some period of time. The idea then is, okay, so if you go back to the first thing, motivation, if the person does not want to stop, there is nothing really a family can do. Right? And that's the hard piece. And the more you escalate the battle, the more it comes into a power battle. Now, and quite often, you will see, with kids, it's a slight different, right? You'll see a 45-year-old man who's the breadwinner of the family, controls all the finances. Is an alcoholic, doesn't want to stop.
Yeah. So the family ends up.
Yeah, so then we have to support the family through that period, right? About how do you keep your sanity, how do you engage the person, how do you try to get a conversation about, maybe start with trying to say if you want to moderate, So that's the whole strategizing, that's the whole family support program, right? About how do you do this. Because in the vast majority of cases in my practice, it's the family who comes first. Right?
Sure.
They will always say, I'm concerned about my son, my husband, my daughter, and all.
Sure.
Right? It happens now, thank God, increasingly more and more that people are calling straight up and saying, look, I think I have a problem with this substance. That's also happening. But it's still, the bulk of them, the family will come first. So then you got to strategize with the family about how to have that conversation, how to get him to come and see me. And then we start from there. So that's, in my head, I call that pre-treatment. So there's actually a scientific protocol called motivational enhancement therapy.
Okay.
So any stage of behavior change, right? Either we are in pre-contemplation. This is not a problem. I'm not even thinking about it. Contemplation, this I think could be a problem, but I'm not motivated to address it. Then it's preparation. Okay, I need to take this on by the 15th of December. I'm going to do A, B, or C, or call a therapist or get into a program. Then there's action, and then there's maintenance. So motivational enhancement therapy assesses where the person is.
Okay.
Right? And you got to move them through the stages of change. Right? So if somebody is in pre-contemplation, he's not going to get into recovery tomorrow, into action. You got to move him to contemplation. Right? So he's saying, I don't know why this is a problem. I don't know why everybody's making a big deal about it. They're just drama queens. The family sitting there and say, but this, that, and the other. Contemplate. How do you move a person, right? So the first thing is, you got to express empathy, right? Then you develop discrepancy. You're saying to say, okay, you seem to be saying the following, right? But this is what your family is observing, right? So you develop discrepancy between what they're saying and then discrepancy about what they want to do and how this is coming in the way, right? And so you get them to think about, okay, this could be a problem, right? Then most of them will turn around and say, okay, but I guess it's a problem. I'm willing to cut down. I don't want to stop. You say, okay, so let's define control. Let's define quantity. Let's define frequency. And let's define behavior. Because if I can dictate how much, how often, and how I'll behave, then I guess I'm in control. Right? So if you tell me your idea of control is I'll start drinking at 7 in the morning, the boss, that's not happening, right? And that will become very obvious then in the conversation, right? Absolutely. So most people will say, I'll drink 2 times a week or 3 times a week. I'll bring it down to that. I'll have no more than 3 drinks, right? And I'll make sure I don't shout or fall down.
Right.
Wonderful. Can we involve a family member because I'm not in your house? Who would you trust for collateral information? Let's get on with this. And so you engage them that way, right? Then through that process, they come to a realization, can they control it or is it not happening in control? Right? If it's not happening in control, then you prepare them, okay, so then we're now looking at abstinence. I have to give it up for the rest of my life? My experience tells me so, but you need to come to that by yourself. So why don't you commit to an X amount of period?
Right.
When can you start the program of recovery? Then you walk them through what the program is. By then the family is involved. So it's a process. And a lot of times the family is saying, I've sent him to a therapist is drinking, should stop from tomorrow.
That's not,
That's not going to happen.
Yeah. It was very refreshing to speak with you because you just directly told them what was going on and that they needed to get over certain things, etc. And that made me realize that, if you have an addiction, working with a regular therapist versus a specialist like you, the approach is very different. What is different in that approach?
So a lot of times when you trained as therapists, right, it's a very supportive kind of, so there's a certain amount of directness that, especially in addiction therapy, is Very important. See, one of the defining things in addiction, right, is this thing of denial. Right? So people, if they're struggling with anxiety or depression, come in on their own volition, or because there's a lot of suffering that's associated with these conditions, right? So they come in very open to whatever suggestions you're making. When you come in with an addiction, there's denial. Then denial comes in, I don't have a problem, but it also comes in with minimizing. It's not so bad. It comes in with rationalizing because my job is so stressful. There's a multiple ways, right? And most people, when they come in with an addiction problem, their initial goal is they really want to do this in moderation. They do not want to quit. Now, when you go to psychology school or therapy school, you say you have to support the client's goals.
That's true.
Right?
Yeah.
Now, after working in this field for a long time, and then you do a couple of assessments, right? And if a person meets criteria, they are not going to be able to use in control. Some of them can, especially for the process addictions, about how do you minimize that. For the substance addictions, it becomes very apparent early on, right? So if I'm then supporting this guy's goal for moderation, then I'm just making money off you, right? You'll come and see me every month, once a week for 1 year, right? And you'll have some initial successes, then you lapse back, and then you do that whole dance, right? So at some point, it becomes my responsibility to be the bearer of bad news, right? In which you have to say, abstinence is the only solution. Never again, not for that, not even at parties, not even at weddings. And that takes a lot. But after you do that, you got to hold that space for them, right? Because that's a massive thing for most people who develop an addiction to consider. Right? So there's a certain amount of directness, but all you say, the honesty with compassion. Right? And so I would always say, I know that sucks, man. I hate to be the person who's telling you this, right? But it really sucks. But so I would tell them that. And if they say you still want to try, I said let's give this a month. You want okay? I don't. The science and the reports are saying that this is not this, but you really want to get this out of your system. Let's do that. I'll teach you some skills that work with people who don't have an addiction. Right? That how do you space your drinks? How do you And most people, when I tell them, okay, you count your. So if you want to reduce your drinking, right, or the effects of it, one of the things is you count your drinks. You count how much time you spend on a drink. Right, so you don't drink gulps, and you nurse it over a period of time, and then you eat along with that. Most people who have an addiction will tell me that's too much work, doc. Right?
Sure.
Right. So quite often you have to be very direct and be the bearer, be the bad guy, and say, look, it's not going to happen. Right. And then I said, I can introduce you because I've worked over the years. I've got a lot of people who have helped, right, in recovery.
Yeah.
Who were exactly where you've been. All of us, when it was first suggested to us that you got to quit, we were like, hell no, there has to be another way. Maybe I can try this and all. So if you then talk to people who will not give you gyan, who will share their experiences when they tried this for moderation, what happened to them, and then the group becomes extremely powerful, right? So it's not like this Dr. Saber sitting in the chair and giving me this. I'll introduce you to people who were obviously sober, clean, and happy now. Who have obviously tried this moderation thing for a while. And then when you see that other people can do it and that it can be done and life can be great after that, right? So the combination of the individual counseling and the group thing becomes very important in that.
And that's what somebody like you would bring to them rather than just that one-on-one conversation happening.
So I'll come with somebody who will say, I'm an investment banker, man, this is what we do.
Right.
Or I'm a corporate lawyer. All my meetings are all over. We drink alcohol, and they won't admit it. I mean, you do various kind of substances. How am I going to fit in with this? I'll show you some investment bank. I'll introduce some guy who's in this position, who was exactly in the same situation you were 4 years ago. We get this with doctors all the time. Right? So I will introduce you to the right amount of people. There's a whole group of people. Everybody's been there. So whatever walk of life you come for, about 15 years in India has been a long time working with this, right? There are quite a few people who stay plugged in, who are very happy to help. Right? So I say, go and meet so-and-so for coffee.
Have you had any case where someone has not wanted to meet the others? Because like generally
happens very often.
It does, right? Because even with ADHD, people will say, okay, you're sure, right? Don't mention it to anyone. Or they will always come and tell me where they are going next, because South Bombay is also small, so they don't want to bump into me.
All the time. And it's the concern is understandable. There is still stigma, right? And so whenever I tell people that the modality, the program that I have is individual, group, and family, more than half of them will balk at the idea of going to group, as I did. Right? I had the same fear. What if I see somebody over there? What will they think of me? Right? What am I going to share? I'm an introvert. So if I meet people over there, they're there for the same reason that you are.
Right. But you're so self-consumed
Zoomed,
in you that you can't look at that.
Yeah. And so therefore I always say, I encourage them. Like, if they say, I don't want to come to group right now. I say, okay, let's start with the individual. But I keep pulling and say, why don't you just try one group? We have groups on Wednesday morning and we have groups on Saturday, which are outside the program, which are people with long-term sobriety in them. Right? You may meet some people. If you don't want to do that, why don't I introduce you to 2 or 3 people from the group which you can meet outside? If you get friendly with them, then you get strength in numbers to come.
Sure.
What will I have? Do I have to say anything? You don't have to say anything. If you want to say something, you can say something. If you don't want to say anything, you can just listen. What's the point of that? Because then you get identification. You realize you're not alone. There are other people have had similar issues, some more serious, but they're sitting and laughing and joking about it now. Right? So that inspires strength and hope, right? So, but that is an integral part of it. This is how is it different working with addiction, right? The first part is being cognizant of the denial and sometimes being the bearer of bad news. Then to encourage people to get over their fear about group and how do you connect with that, right? How do you make peace with the family? Because by the time you come in, your family system, whether it's with your parents or with your spouse or you're with your kids sometimes, is in shambles. There are very few relationships that survive unscathed with this, right? So I don't want my wife in the process. Okay, theek hai, but at some point you're going to live with her, right? So that whole hand-holding through all these components is 15. Sometimes I think I should go back to working with mental health, right? It's a lot easier.
Yeah, sure.
But it takes that, right? And then there's this thing about, okay, I don't want meds right now. So a lot of this is knowing that these concerns are valid from where the person is coming, but to sort of encourage them in a safe environment with baby steps to say, okay, why don't we just try this? Why don't we just try this? Right? While simultaneously saying, but after a point, if after 3-4 months, if a person is saying, look, I don't want to do groups and I still want to drink in control because it's not happening, but it's not happening, then I have to tell them, dude, maybe you need a different therapist here.
Anybody in India, I think the minute a therapist or a coach, at least whenever I hear any addiction, I'm like, please go to Dr. Azhar. No, because it's important, right, to deal with that aspect before you start building your skills, because otherwise you're, like you said, in denial of the real root cause of what is making your executive functioning worse. Because of course, if you're constantly on alcohol, your focus is not going to get better. Your attention is going to get worse, right? So there are ADHD comes with a lot of shame, guilt, judgment, and many other negative emotions that somebody sort of goes through. We often talk about what is a story that they are constantly reliving. And you spoke about how the family can support or create, family, friends create that support system or compassion for the person. How do you suggest somebody who is going through some sort of addiction hold that space for themselves?
You mean the family? Or
the individual for themselves.
Yeah, that's central, right? So by the time we've come into this recovery process, right? So what's already happened is that I've tried, either my family is this thing, but I've tried on my own. For the most majority of people, I've tried in some way to cut down, if not quit, right? And they haven't been successful, right? So pehle se there may have been feelings of inadequacy, of shame. Now it's despair. Now there's this failure. The whole perception of self is really not in a good space, right? So to shift that, it's not me telling you, right? That learning is not cognitive. That learning is experiential, right? So it's about celebrating the baby steps. So have you heard of fellowships like Alcoholics Anonymous and Narcotics Anonymous?
Yes.
Right? It's the only place in the world you can get a standing ovation for not having a drink for one day. Because they know how difficult it is. Every 30 days they'll give you a chip and they'll cut a cake. My family will say, okay, he's not drunk for 30 days. What do you want to
Yeah.
do? Give him a medal? Yes.
Yes.
Because what is easy for you may not be easy for me. Right? So to celebrate the baby steps, right? To give the person a sense of that cheerleader, we're on your side. This is great. Celebrate the small victories. Right? So I encourage everybody who comes to me, go to meetings. They're there every day, right? All over the city. That's another battle. That's very unique to addiction, right? To get. I believe it's a great help. I don't insist, but I gently recommend that you try out a couple of meetings because there's a wealth of experience in those rooms, right? The second thing that diminishes the stigma and the shame again is the group, right? Because you realize that this is not a character flaw in yours because you have a certain condition which has hijacked your dopamine system, right? You have behaved in a particular way. This is not unique to Vikram or Pooja. This happens to everybody who has this condition, right? It's not you personally. All your behaviors, all your stuff, and the poor choices you made are a manifestation of your obsession to get and stay high or use gaming or gambling, right? And you made choices that have been driven by this obsession, which we now understand as biological, right? But then when you see a whole bunch of people who've done exactly the same, right, and have stopped doing it and can laugh about the stuff they've done and their families are together and their relationships are healed, that gives you the thing to say, okay, I can also do it.
And
Right?
someone's
So the
literally gone
community,
through
yeah, that community, that sense, right? It works on, I know how you feel. It works on 5 words. Right?
And I really know
I've been
how
there, dude.
Yeah.
Something as recently as 2 years ago, I was there. So because you have people, so in the group, I have people who are 1 day sober and 15 years sober, and everything in the middle. Right? So you'll always find somebody who you connect with, right? But it takes courage. I get it. It's not easy. There's a lot of all this stuff in our head, but if you show up a couple of times, it really helps. I know it changed me completely. Like when I walked into a group, right? So I come from a Muslim family and all, and nobody drinks, right? So पहले से I could hear that voice, अच्छा हुआ, किसने बोला उसको पीने को,
right? So even then, that support,
yeah,
your perception of how they would see
see
it
it,
is,
yeah.
is sort of.
Yeah. So my parents would have been no issue, but I know what my aunts and uncles were saying.
And I guess then there's also that further guilt of, oh, what my family is going through so much embarrassment because of
Yeah. So there are
me.
two ways that, so either I feel guilty and ashamed all the time, or I erect a defense and act exactly overcompensating. I don't give a shit. And then I will come up with some reason my father behaved this way and my mother is like this to justify my terrible behavior.
So we're good at
Arey,
convincing
master,
ourselves.
PhD level.
Yeah.
So I grew up believing the sole cause of the problem in my life is my father. A very tough man. He had no empathy. He was one of those, came from nothing and went to MIT on a full scholarship and started his own business. And life didn't cut him any slack. So he didn't believe why anybody should get any slack. So he was very direct.
Right.
I was a sensitive kid. Right. But I made him into the villain. I didn't understand the interplay, right, about what was going on. I just made he doesn't know how to speak. He does this. He makes me feel shit about myself. Therefore, I'm an alcoholic. But that's not, so either you can fix the problem or you can fix the blame. Yeah. You can't do both.
I feel like in India, people just need to talk.
Yeah. No. Everywhere, boss.
But there's this, I was talking to Marzia, Marzia Mascati about relationships and ADHD. And the only thing that kept coming up is that in India, we look at, harmony, we need to maintain the harmony of our house. So you know what? Let's not address it, right? Yeah. So I guess it's the same with addiction and every single thing. Just have a conversation.
Have a conversation. Yeah.
Don't get defensive.
If you study evolutionary biology, you look at social anthropology, you look at common sense, right? We are social animals, right? Our whole hardwiring is to live in communities and tribes. That's what we've done for 20,000 years. When we are born and you feel you poop or you're hungry, you feel the distress, right? Your mom, hopefully, provides comfort and nurturance. That hardwiring of connection for soothing and comfort is there. There's no escaping it. We then layer that with individualistic philosophy. You must be your own man. You must do everything. You don't need anybody else. Nothing but ego. And we will all suffer for this ego. I should be able to do this on my own. Arey, kyun bhai? When people are saying, you want to go to Alibag, there's a boat going. What do you want to? You want to swim to prove what? Take the boat, no?
Right.
No, I will swim. Right? But you're right, we don't talk. And you're right, it's about harmony. In the name of harmony, we withhold. We don't say what we really feel. My philosophy in this is if something is bothering you, the question is never should I say it. If something is bothering you, you need to say it. The only question is when to say it and how to say it. That requires a little bit of interest because you got to say it with honesty, but you got to say it with love, you got to say it with compassion, you got to make sure there's no disrespect. You got to figure out the timing that Ankita needs to have the bandwidth to hear this right now. It's not about me just getting my stuff out, right? So communication is key, man. It's the only way that I don't feel that apartness, no? And most addicts, most of us when we come into recovery, see, no matter where you start your drinking and your partying with the clubs and the five-star hotels, you will end up alone in your room, right? Doing it on the sly. Right? So there is a crippling sense of isolation and loneliness. It may be masked by a bravado and bluster. I don't need anybody's help. It's there.
But it only comes to cope. It becomes a coping mechanism.
So you're absolutely right. And the because of the traditional cultures that we grow up in about you shouldn't say this to your brother and you shouldn't say this. Forget say this, you shouldn't think this way. Right? You shouldn't think this way.
Yeah.
Right? So my standard phrase is if thought bubbles, comics mein, if thought bubbles appeared over my head, I would be in prison. And that's okay. I'm responsible for my actions, not for my thinking. Right? Every thought, every feeling is valid. What do I want to do with it?
Yeah. So you always act because of your thought. How do you? That's what you. Okay, so Doc, that's been very, very insightful. And I'm sure we can talk for a couple of more hours. But let's, before we close, let's quickly do a rapid fire. Whatever comes to your mind, I'm going to ask you a few questions, give you a few statements. Whatever is the first thing that comes to your mind. So the first one being impulsivity or boredom, which is a bigger trigger for addictive behaviors according to you?
So it depends on the person, right? A lot of this, so for some people, you're saying in general, boredom.
Yeah?
Yeah, boredom.
Family shame or peer influence, what is a stronger relapse trigger?
Family shame.
Really?
Family shame.
Community support or self-discipline, what matters more in recovery?
Community support.
Medication or routines, which is the first step to recovery?
First step, routines.
Routines?
First is always routine. Medication always, if and when necessary, if the routines are not hacking, it's not making a difference. Unless, like I said, it depends on the severity, right? If the severity of the condition is that there's earlier in the chance, routine ka chance hai hi nahi. Till there is some stability and the agitation goes down, then you need to start with medications. But the thumb rule is always start with routines.
Is there anything that you'd like to share with everybody who's listening, watching before we close? Any last thoughts?
Yeah, the basic thing is that whatever you're struggling with, right, you don't need to do it alone. Right? We all are struggling with something or the other. Right? Life according to Instagram is the biggest lie. According to Instagram, we're the happiest we've ever been in the history of civilization. Right? We're all struggling with stuff, right? And we've got multiple life domains, and none of those domains are always perfectly in sync. There's something wrong with my health, there's something wrong with the relationship, I'm stressed about my kid, there's some financial stuff going on, there's some mental health stuff going on. This is part of the human experience. It's normative. You don't need to do this alone. Right? You can, if you reach out, whether you're reaching out to a community, a group, a therapist, a family member, a loved one, right? You don't need, we're not designed to deal with all this alone. We've grown up in tribes and villages. If you reach out, there is very little in life you can't overcome. Right? It may take a little time, it may take a little bit of patience. But I always say, grab a few hands, say a prayer, and think miracles can happen.
That's beautiful. Yeah. Thank you.
Thank you.
Thank you very, very much. Today was honestly just fantastic. So there are many things that I'm going back with. Some of them are the first definitely being that you're always sort of recovering, right? If you're an addict, you're a recovering addict, and that sort of keeps you grounded in some sense. The second one being the 3 rules of recovery: motivation, strategy, and community. Community being a huge part of the recovery process, your friends, your family, and most importantly, the others who have been through the same journey that you are currently on. So attending those meetings continuously becomes a huge part. And I think lastly, what you mentioned, that someone at home will not clap for you if you've not had alcohol for a day, but if you're in your NA or your AA meeting, you will get that standing ovation, and celebrating those small wins for somebody who's recovering becomes a huge part of their recovery process. So thank you so much for being here and sharing everything that you shared with us today. So if you've ever felt misunderstood about your ADHD, I hope today's conversation gave you some clarity and comfort. So do share our episode of ADHD and addiction with anyone you feel can benefit from this conversation today. This is me, Coach Ankita Jagtiani Dadachanji, signing off. Remember that ADHD is not a flaw, it's just a different rhythm, and we're all here to dance to it together. So thank you so much for watching, and I will see you in the next episode.